the COVID-19 task force, and all the stakeholders, we are working real hard to do so wisely and safely. However, the responsibility, it's an all of society responsibility. And so you, the general public, everyone, everybody in St. Kitts and Nevis, we have a part to play as we prepare to open our borders. Because once you open our borders, the risk of reintroducing the virus increases. And so each of us, we all have a responsibility to play in terms of reducing our own risk of exposure to the virus. And in so doing, we will prevent, we can all work together to prevent a second wave of infections. And so all stakeholders must adhere to the infection prevention and control measures that are being shared as we speak. These measures are meant to ensure safety of our frontline workers. And when I say frontline workers, I mean frontline workers within the arrivals aspect of the airport, frontline workers in terms of immigration, customs, health, or taxi and tour operators, the front desk staff at the hotels, the persons who will be working on these excursions and at the local attraction sites. All right, so we all have a part to play in terms of adhering to the infection prevention and control measures, all right, to ensure our safety of our people, and safety of the inbound traveler, tourist, and returning national. Ladies and gentlemen, we must all wear our face mask when in public spaces. This is critical. And this is, some of us, we've gotten lax, but we really need to take this on board. All right? And leading up to October 31st, we need to wear our face masks. You know what I do? I wear sexy-looking face masks. All right? So whatever you need to do to encourage and motivate you to wear your masks, please let us wear our face masks. Yes. We must always maintain good hand hygiene. All right? We need to keep our hands clean with soap and water and our alcohol-based sanitizers. We need to keep our hands clean, keep our hands from our eyes, nose, mouth, please. We need to maintain our physical distance. We need to maintain our physical distance. And I say 6 feet because some of the international organizations say that it can be, we need to maintain a distance of greater than 1 meter or 3.3 feet. But in following CNN on the weekend and these super spreader events in the United States, some of these events were in open air. And so it's important to maintain a distance of 6 feet at least. That ensures you are protected. And we all have an individual and collective responsibility of avoiding crowds and events where a number of persons are gathered. And so now if you're following the news, you are hearing about these super spreader events. So really and truly, we shouldn't be organizing any super spreader events, and we all have a responsibility to stay away from these super spreader events now, and even more so after October the 31st. On a different note, dengue. There are a number of islands, neighboring islands, that are reporting confirmed cases of dengue. And once our borders open, we run the risk of having cases locally. So at present, our vector control officers, they are working very seriously in terms of source reduction and even fogging and spraying to reduce the mosquito densities. And so as a means of reminder, again, we all have a collective responsibility in terms of preventing a local dengue outbreak. And so we are advised to stock up on a good mosquito repellent, eliminate standing water in and around our homes. And so yes, we've been getting some good rainfall, and the water settles in empty, dirty containers in and around our homes. We need to walk through our homes at least once a week and rid ourselves of eliminate standing water. Make sure our screens on the doors and windows are intact so that the mosquitoes stay out. Wear protective clothing early morning and at dusk. Again, just some additional reminders. You could even sleep under a mosquito net. So remember, prevent mosquito breeding sites in and around your homes. So that's the take-home message. Empty, clean, or dispose of containers that hold water in and around your homes. I thank you.
Thank you very much, Dr. Laws, for your comprehensive presentation. I now invite Mr. Abdias Samuel, who is the chairman of the COVID-19 National Task Force and the National Disaster Coordinator, to give us his presentation. Mr. Samuel.
Good afternoon, and thank you, Mr. Williams, and to all our viewers and listeners all around the world and locally, regionally. Before I start today, I just want to highlight some information that I received while awaiting my opportunity to address you. And this is a report, a press release, by the Department of Health and Wellness in St. Lucia. It says that today, as of today, Wednesday, October 14th, 2020, St. Lucia recorded 2 new cases of COVID-19. The individuals are a couple, a 38-year-old female and a 47-year-old male of Castries. They both developed respiratory signs and symptoms, which led them to seek care at a community respiratory clinic on Monday, October the 12th, where they were treated for their symptoms and tested for COVID-19. At that point, they did not report risk exposure to COVID-19. Again, let me repeat. At that point, they did not report risk exposure to COVID-19. As per protocol, they were sent home for isolation, awaiting results. Upon receiving their confirmed COVID-19 results, arrangements have been made for their transfer to the respiratory hospital for care. Their son, who is a secondary school student, shall be assessed and tested for COVID-19 and placed in quarantine. The classmates and teachers shall be assessed and will be kept in home quarantine until these test results are received. Contact tracing has commenced for the possible contact of these 2 new cases. That's how much impact 1 or 2 single cases can have on a country. It's very important, very, very important that we adhere to the protocols that are being recommended. Today, I just want to be brief and highlight just a few things. I want to speak to the civic responsibility that we need to exercise in doing our part. In particular, as we endeavor to maintain the status of a low-risk country here in St. Kitts and Nevis. How can we achieve this? 4 critical things I'm going to highlight today. We need compliance by our business and corporate partnerships. We need staff development, continue the public-private partnership, and infrastructural enhancement to safeguard the staff first and the customers. The public response is very important. It's going to require a cultural change and adaptation to the new norm. It's also going to require a strict adherence to the non-pharmaceutical measures, as was just stated, the wearing of the mask, hand hygiene, and staying away from events that can be super spreaders. 3, supporting the legal framework being used to prevent the spread of the COVID-19 virus. And these are critical elements that are needed. And I want to highlight by saying that any individual with a neglectful approach to combat the spread of the disease will only regress the progress made in the fight against the virus. Let us not allow ignorance to regress the progress we have made together. It only takes a single exposure of one citizen to take the country into regression. On a lighter note, I wish to continue my invitation to all of our citizens, residents, and visitors to our week of activity. Yesterday, we would have seen an address by the Honorable Wendy Phipps, co-chair of the Mitigation Council and the International Day for Disaster Reduction. And the theme for that day yesterday was it's all about governance. We have seen, and I keep saying it, once you have good governance, you have a great chance of defeating the virus. So tomorrow, I'm inviting all to support NEMA and its partners in the Family Feud. The Family Feud will take place tomorrow evening, and we are asking all to come out and cheer for the team that will represent NEMA. We will also continue with our Face of the Districts and our trivias. Please log on to our website at www.nema.kn. And Friday will be our day, our staff development day. You are invited to pass through NEMA, engage with the staff, talk with us, and if you want to share a drink, non-alcoholic drink with the staff, you can bring them and do so. Right, Vesta? On Saturday, there will be a volcanic hazard tabletop exercise for the NEMA districts, and this is a way of testing our volcanic preparedness plans and also involving the districts at the community level to be prepared. So the general public, there is nothing better than having a well-prepared country to respond to the effects of any type of hazard. It is said, again, and I will repeat, as I repeated on Sunday, if it's not risk-informed, then it has a human cost. If it's not risk-informed, it has a human cost. And I am certain we don't want a human cost, and this is why we have been fighting really hard, working really hard to ensure that we defeat the COVID-19 virus, and we will learn to exist and coexist with it. We are in the Atlantic, we are experiencing a tropical disturbance that is traveling north-northwest and through the Caribbean chain of islands. Associated with this disturbance will be some moderate to heavy showers within the next 24 hours, accompanied by thunderstorms. So tomorrow morning, if you wake up and you see the lot of rain, you hear the lot of thunder, lightning, and you may experience some gusty winds, it doesn't mean that we are going to close down the country. It means that I want you to remain vigilant, observant, and listen to all the necessary warnings and precautions that will be provided by our local Met Office and also by the National Emergency Management Agency, NEMO. Again, log on to our website, go to our Facebook pages, and stay informed. Listen to our local radio station for any information. Once we receive heavy showers, I'm asking road users, whether pedestrian or motorists, to exercise caution in passing by these waterways. You know the known waterways here. So please exercise caution not to park in these areas, and the areas that are known to have the potential for landslide and rockfall, exercise caution. If you can avoid them, avoid them. If not, please proceed with extreme caution. I want to take this opportunity to thank the Emmanuel Methodist Church in Sandy Point for the excellent job they did in hosting us on Sunday during the church service, but most of all, the implementation of the protocols that they have in place. It was evident with the pressure checks, the temperature checks. I think pressure maybe want to check for real, Dr. Lars, yeah? For example, the temperature checks that was done, after the temperature checks was done, you were logged in a book, and your temperature, your name, your contact information, which is for traceability. There were markings on the ground for the spacing. The seating were properly spaced, so therefore it will minimize the risk of you coming in contact with anyone that may have had the virus. I want to thank the Christian Council and Evangelical Association for their partnership. Now, considerable amount of work is being done at the RLB International Airport, and we are hopeful that the same will be done in the ports of entry by sea, at the seaports and the various marinas. We should be holding dialogue with our marina operators and also with the yachting community as we seek to also strengthen the inbound passengers via the sea. That is very critical. Again, thank you for listening. We are preparing. We need the general public to come on board and support our efforts in opening our borders. There is no fear. We shouldn't have no fear. What we should have is a well-prepared citizenry, our residents, our visitors, and we ensure that persons adhere to the protocols. Once you do that, I think we can be good in receiving our persons. Allow me to also welcome the Ross University students. I must highlight that the Ross University of Veterinary School has been doing a wonderful job in collaborating with the National COVID-19 Task Force, collaborating with the local authorities in helping us to stimulate our economies, creating economic opportunities and activities, and also in facilitating those students who need to complete their education. We have learned a lot from them, they have learned from us, and I'm certain that the lessons out of these engagements will help us prepare for what is to come when the borders open. So let us continue that equilibrium between the health and the science and with the creation of economic opportunities and activities. Thank you very much for your support, our beloved citizens and residents, and I hope that we continue to remain vigilant as we will endeavor to open the borders on the 31st of October. Thank you.
Thank you very much, Mr. Samuel. That brings us to our question and answer segment for today's briefing. I will start the questions for today. Now that the borders are reopening, can we get the number of rooms available for quarantine, and how many rooms are available at the various institutions for the short-term stay for quarantine? Dr. Laws.
Okay, so international travelers, tourists, as I said, you'll fall in the second category, and so you'll be able to log on to the site, and you can stay at the branded hotels. And so I really do not know the capacity at the branded hotels, Mr. Williams, because those are open to the inbound traveler. The Oali Beach Hotel and the Royal St. Kitts Hotel will also be accepting inbound travelers at this time. And so the facilities that we are using now also includes OTI and Potworks. All right, and so each of these establishments, have their, capacity. I can't speak to the capacity of the individual facilities.
Thank you very much, Dr. Laws. Before we proceed, we would just pause for the playing of a video which has to do with the border reopening.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis, therefore, announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part. Therefore, self-help management is an important step in this process. Self-help management refers to the measures people take to manage their own health. You and I should remember to wash hands often with soap and water, or use alcohol-based hand sanitizer. Avoid touching your eyes, mouth, and nose. Take your temperature morning and evening. Watch for symptoms. Persons with diabetes or hypertension are reminded to take your medication regularly as prescribed. If you have no symptoms, you may carry out your normal routine and boost your immune system. When you are outside, avoid public spaces and wear a mask at all times. If you develop symptoms, put on a mask and seek medical care. Do not take public transportation. Inform the doctor of your travel history, any contact with confirmed or suspected cases, your occupation, and whether anyone around you has similar symptoms. If you become ill, please rest at home. Wear a mask and isolate yourself from others in your household. If you share a bathroom, disinfect daily using 1 part bleach to 10 parts water. Everyone must work together to reduce the spread of the coronavirus when our border has been opened.
Okay, welcome back. We continue with our questions. These 2 questions are from Vaughan Radio. Last week, it was mentioned that the prices for persons quarantining at a number of hotels upon their arrival. Can you also give the cost for returning nationals, as persons are eager to return back to their home? And the second one, Barbados has recently welcomed the option of tourists staying on the island for work or to study, which will or can generate more income for the island. Can we implement such an option in the Federation as well? Dr. Laws.
Okay, so Mr. Williams, two good questions. In terms of the prices for persons who would be vacationing in place, I would prefer to use that term. Now, if you are going to any of the branded hotels, you will have to call the front desk reservation, and then you will be given the cost for vacationing at that location. So if you're going to opt to go to Royal St. Kitts Hotel or Oahu Beach Hotel, you call the front desk, make a reservation, and then you will be told the cost. OTI, I can provide you. The cost remains $500 for the duration of 14 days. Yes, and then of course there is a $100 fee for the PCR test at the end of 14 days. And if you're an international traveler staying at one of the franchise hotels, you will be tested, serial testing, day 7 and day 14. And so that provides you an overview of the costing in terms of where you will be vacationing in place. Now, in terms of the other question, Barbados is really targeting visitors, tourists with who will be on island for a longer duration of time. And so in the context of COVID-19, that target group is the preferred target group, meaning tourists who are willing to come into country for a prolonged period of time, meaning 3 weeks, 1 month, or even beyond. And so a number of persons the world over, they are working from home, they are working virtually, and so you can opt to leave New York or Miami or London and, work in a villa, a hotel room in St. Kitts, Nevis, and stay with us for 2 months, 3 months, 6 months. And so that's the preferred guest or tourist that we would be, that we should be targeting, persons who are here for a longer period of time. Thank you.
Thank you, Dr. Laws. That brings us to the end of our question and answer segment for today and the end of our NEOC COVID-19 weekly briefing for the 14th of October 2020. Thank you very much for joining us today. Thanks to Superintendent Henry, our CMO, Dr. Hazel Laws, our Chairman of the COVID-19 National Task Force, Mr. Abdius Samuel, our Medical Chief of Staff, who is here with us as he always is, to Vesta Southwell for her support. We thank the ZIZ team, and we continue to thank all the media in the Federation for partnering with us. We also thank our dedicated sign language specialist, Mrs. Christmas Jacobs, for being with us today as well. Thank you very much, and we will see you next week, Wednesday, for another briefing. I am Les Roy Williams.
Thanks to the nation's the success of this strategy